Nothing gives a woman more relief than learning that a lump in her breast is harmless. But relief can turn to frustration when the lump gets larger and more tender, or when additional lumps begin appearing. Even though the discomfort eases after menstruation, it comes back month after month. This condition, called fibrocystic breast, occurs when tiny, fluid-filled sacs form in the milk-producing glands. For many women, making a few simple changes in their diets can help keep it under control. Research has shown that, by giving up a few foods, you may be able to eliminate the lump entirely. Try these 4 steps to help. 1. The caffeine connection. If you drink a lot of coffee, tea, or cola, your breasts may be paying the price. Beverages with caffeine contain compounds called methylxanthines, which can cause lumps in your breasts to become inflamed and tender. And the more caffeine you consume, the more tender your breasts are likely to be. In a study at Ohio University in Columbus, 45 women who drank an average of 4 cups of coffee a day quit cold turkey. After 2 months, 37 of the women reported that the lumps and tenderness were entirely gone. Women who drink little or no coffee are much less to get fibrocystic breast in the first place. Researchers at Yale found that women who drank about 2 cups of coffee a day were 150% more likely to develop fibrocystic breast than women getting no caffeine. Women who had 4 to 5 cups a day were 230% more likely to have the problem. 2. Lean relief. It's not only what you drink but also what you eat that can cause tender breasts. Research has shown that women who get a lot of fat in their diets, especially saturated fat, the kind found in meats and dairy foods, are more likely to develop fibrocystic breasts than women who eat leaner fare. This is probably because a high-fat diet increases the amount of estrogen in the body, which can fuel the growth of lumps in the breasts. You need to eat a low-fat diet for about 3 months to see if it helps. That's how long it takes for the estrogen circulating in your blood to decrease. To get the most protection, you should limit the amount of fat in your diet to 20% of total calories, the same amount used in the study. There are many ways to reduce the amount of fat in your diet. For example, you should avoid red meats, drink low-fat milk instead of whole milk, and eat more fruit, vegetable, legumes, and whole grains. 3. The fiber factor. Reducing fat is not the only way to lower estrogen levels in your body. Eating more fruit and vegetables not only reduces fat but also provides more fiber in your diet. Fiber can help reduce swelling and tenderness of the breasts by absorbing excess estrogen and carrying it out of the body. The daily value for fiber is 25 grams. That should be enough to reduce the estrogen and help ease the pain of fibrocystic breasts. One of the easiest ways to get more fiber is to eat bran-containing cereals at breakfast. Eating vegetable, fruit, legumes, and grains will also add fiber to your diet. 4. Get ease with vitamin E. There is not solid scientific evidence to prove that it works, but more women and their doctors say that getting more vitamin E can help reduce the pain of fibrocystic breasts. Since vitamin E helps stabilize fluctuations in a woman's hormones, it makes sense that it might help. One way to get extra vitamin E is to take supplements. But getting more vitamin E in your diet can also help. Even though the best sources of vitamin E are vegetable oils like sunflower and safflower oils, you can get this nutrient from foods as well.